Okay. So the first, like just to start it out, if you could just say your name and explain what it is that you do.
Sure. My name is Andrew. I'm a physical therapist by training. I have a board certification subspecialty in orthopedic physical therapy, and I've been practicing now by myself for 4 or 5 years. And I've been practicing as of kind of clinical stuff in graduate school since about 2018 in more outpatient kind of clinics, but I do have some dibble dabble in inpatient neurologic rehab and stuff like that.
All right. First question is, how do you define your philosophy on patient care and rehabilitation as a physical therapist, and how does it align with the overall vision of your healthcare organization?
So we're referencing the overall mission and vision of our healthcare organization locally at the 673rd RMRS here at JBear. And this is actually new as of, I want to say, October. Our squadron commander just realigned our mission, vision, and priorities. So our mission is to optimize joint medical readiness to project air power, and the vision is operational medics perfecting the Arctic warfighting advantage. So very like niche, kind of specific words to Alaska and outdoorsy kind of things. But to answer the first part of the question, one of my key kind of principles of just patient care in general from, I'd probably say I started kind of keeping this in the back of my head maybe like 2020, 2021, as there was like a year or two out. And one of my instructors said, hey, all you have to do is take care of your patients in whatever way that means to you. If you take care of your patients, everything else is going to take care of itself. And that kind of like simplified it for me because I feel like as a new grad, like you learn all of these things and there's all these like exam tricks, treatment tricks, um, other behavioral stuff, mental health stuff, physical, spiritual, that all kind of funnel, kind of like we were talking about before, into that physical therapy realm, plus all of this other stuff that affects us kind of as at a human level. And it was hard for me at first to like kind of funnel all of these things and not get stuck in the weeds of like these really fine kind of manual therapy techniques or these niche treatment kind of things. And it helped me to kind of take a step back and say, okay, what's my priority here? And that's, hey, just as long as I can do my best in taking care of my patients, everything else that comes with wearing the uniform, um, being a big A airman will kind of fall into itself. So I've kind of adopted that as my own like 30,000 foot view philosophy that's not really specific in any like treatment kind of sense. And that's going to be different for everybody. So it's something that I've been kind of spreading to other newer therapists. So I was like, you're all going to figure out your own way to practice the best. We're all practicing within evidence-based practice anyways, because we learn more or less the same material, but just take care of your patients. Everything else should kind of fall in from there.
I feel like you almost kind of answered this next one, but can you share an example of how you've applied that philosophy to drive positive outcomes for your patients? Do you have like any specific examples where like you didn't get caught up in the little details of things, but and it just kind of helped you and your patient overall?
Specific to like a patient
Yeah.
encounter?
Or, you know, anything less. It doesn't have to be like one specific patient.
Yep.
It could be multiple or.
Um, I'll give you two examples. One, I'll preface before I give a specific patient example. A lot of our technicians get caught up in that like hustle and bustle, like holy smokes, I need to see patients, and the system kind of pushes that productivity down on them, and they can feel a big weight of like, well, how am I going to have time for professional development, doing all of my level or 5 level, 7 level upgrade stuff, doing whole airman concept things, having time for my family and stuff like that. And that's something where I usually champion that they kind of adopt their own philosophy, and then I'll drop my little philosophy nugget on it and be like, hey, listen, I know sometimes patient care can be really overwhelming, but just start with, hey, take care of them in that moment, in that 20, 30-minute session. Feel good about that. Try and leave everything else out of it. And then from a leadership standpoint, like I will make sure that you have time for all your other stuff, and that as long as you can do your job really well, we'll make sure that we can push some of the other CRAP off of you and make sure that you have time to meet some of those other things. But specific to a patient example, I think listening is a skill that really helps kind of pull that in. And there's a handful of examples that I can give that kind of touch into that, like it's not really in the physical realm, and now it's more in that, like, hey, we're treating the whole person kind of concept. So something as simple as, like, as we go through a PT intake form, we'll ask a PHQ2 and say, hey, have you had any feelings of being down, depressed, hopeless, or little or less pleasure and interest in doing things as of recent? And I was surprised once I started practicing in a military health setting on how many people would answer yes and kind of like almost shrug it off and be like, yeah, but that doesn't matter. I'm here for my knee. Or, yeah, I'm seeing mental health, but I'm here for my back. And then just taking a step back and listening to them and saying, I understand you're here for your back, but like asking open-ended questions of like, tell me a little bit more about that. Or do you feel like that's impacted your physical condition, your ability to exercise or play with your kids, and kind of taking that 30,000-foot view of like, hey, I'm a physical therapist, but I'm here as I'm just Andrew, helping you try to understand your physical limitations better and get you functioning better as a human. So that's something where I've had more than a handful of examples there of like using that philosophy to just do something as simple as listen, and then having people almost be like kind of taken back of like, huh, okay, maybe that's the first time I've shared that feeling or a thought with a healthcare provider in general, and that makes them more comfortable, like talking to their friend or their spouse or a chaplain or something like that. Or we interact with people usually once or twice a week for at least a month or so. So building that just rapport with somebody who's like, hey, yeah, I'm a PT, but I'm a human too. You can tell me other things that, am I going to address all of those concerns professionally? No, because I'm not trained to. But we can play that kind of holistic therapist role as well.
I love that. Next question. Describe your leadership and management style and how you believe it contributes to effective team dynamics.
I'll give you the same answer as I gave for my number one philosophy. Take care of your patients, and everything else will take care of itself. I really look up to my first boss when I was at Langley, because we were a PT flight, and he was in charge of, I think we had like 25 or 26 staff crammed into this really small, almost like Connex-looking trailer home type thing. So it was really a really tight space for a clinic, and we were pumping people out, not like too much productivity, but enough where it was an appropriate amount of busyness. And I was just kind of operating at that like staff level, fresh out of school, brand new, didn't know anything about the Air Force really, was still getting kind of my grounds as a therapist, and seeing him use that philosophy as as kind of the crux of his leadership style. Like I would always hear him in his office, like making the extra phone call to advocate for a patient, or blocking somebody's schedule for 30 minutes so they could take care of their own thing, or giving them extra time with the patient that they had asked kind of extra time for. And using that really enabled the rest of the staff under him to grow, explore, do things that interest them outside of just seeing a whole bunch of patients in the clinic. So that's kind of like a cool flexibility, and you're going to be really good at your job, but we also still want you to grow as a person, a professional. So that's kind of how he enabled leadership on my first team in the military. So that's something that I try and do going forward, of like, as long as we're doing our job really well, people are generally going to stay off of our backs. And then I can empower you or ask my staff, hey, what interests you? What extra stuff do you want to be able to do? What are your career aspirations? What does your family mean to you, so that they can perform really well when they need to perform at work? And then hit that, like, I'm trying to think of those 5 transformational leadership models or whatever. Yep. The top one's esprit de corps. I don't know what number 4 is, but I feel like that's like the difference between getting from 4 to like a 4.5 or 5. Of like, you're clicking and you're doing really well, but like, I'm sure we've both seen units where it's like, cool, you're meeting your productivity, good, but you're still not firing on that like last cylinder. That's like, now you're a really high functioning team because of certain leadership strategies that your leadership group, among whether it be a CGO, FGO, senior enlisted, even like the junior enlisted members that have been doing it for a while,
Mm.
and having that bleed down to the staff that's doing the work on a day to day.
This really makes me want to work in physical therapy.
Good.
How do you handle conflicts or disagreements within your team? Do you ever have like where you and another provider maybe have a disagreement on a treatment method? I know you all kind of get aside your own patients and kind of maybe don't have to do that, but do you ever bounce ideas off of each other and then kind of disagree on it? Or do you ever have a tech that you just can't get through to, or something with a patient that you just don't like the outcomes to, or something like that? And how would you deal with that?
Yes to all of the above. And I think the one thing as I've practiced more that I appreciate about PT is that kind of we always have a fallback of if what we're doing isn't working, we can kind of refer somebody back to a physician since we're kind of a subspecialty rehab type element. So barring me doing anything crazy that's like harmful with somebody that has a whole bunch of contraindications, I'm probably not going to like hurt anybody with doing what we're doing. So it's not like if a tech was, let's say, doing something, let's take, for example, like, the ultrasound machines. Ultrasound has horrible evidence for working for most tissue kind of things. It's kind of an older technique that we've gotten away from. And most of our clinical practice guidelines will say, don't ultrasound, let's say, like an ankle sprain kind of thing. So if I see a tech doing ultrasound for a lateral ankle sprain, usually I'll try and address some of those things either in the moment or right after they do it, and not confront them as like a I'm right, you're wrong kind of thing, but like, hey, help me understand, like, oh, hey, I saw you do an ultrasound on an ankle sprain. Tell me about their ankle sprain. And then I'll more kind of circumvent it and educate them about the right way to manage an ankle sprain and say, like, ultrasounding isn't wrong. You're not going to hurt him, but there's better ways to do it. And doing it more from a, hey, we want the patient to get better. Or some people are more receptive for like, hey, I want you to be a better tech, or I want you to be a better therapist. Like I would want somebody to call me up and be like, hey, don't ultrasound that ankle. There's better ways to do it. Be better. Okay, cool. Or with some people, sometimes you have to take that gentler approach and just kind of give whatever education or mentorship flavor that they're going to be receptive to. But I think if disagreements are discussed in a healthy, kind of timely way so they don't fester and then people come up with assumptions that might not be right, of like, if I then assume that, oh, that tech probably got trained really bad, now I can't trust them to manage my post-op patients and this and that, where that's just maybe what they learned and they don't know that an ankle clinical practice guideline exists. And then I show them that and they're like, oh, it makes way more sense. So I try not to let things fester if they don't need to. And then, was there a second part to that question?
There was. Like, if your leadership style has ever kind of helped resolve conflict in any kind of team dynamic way?
Yes, same thread. As long as we're doing what's best for the patient. Our team dynamic, if we're doing like the best patient care and our patients are happy, we're probably going to feel better job satisfaction. Patients are going to be submitting good ICE comments that leadership's going to see, and they're like, wow, this clinic is really working well. They must be working well as a team because patients are really satisfied with the customer service that they're providing, kind of a thing. Versus like if patients come in and they see, ooh, the staff isn't really talking to each other. It's not a fun environment to be in, especially when people, like I said before, people are spending, let's say, twice a week, 45 minutes in here. You'd want the environment to be fun versus like just kind of blah, because that's also going to affect the outcome of their rehab, likely, if they're enjoying it and actively participating in what we're trying to get them to do.
What methods do you use to evaluate the performance of your team members, and how do you ensure continuous improvement?
So something that's, let's say, from a performance evaluation standpoint, the new ALQs that actually have like scores associated with them help for actually objectifying and giving a number to some of those metrics on how well they're performing across those major graded areas, versus like, you're doing good and that's your 6-month feedback, or you're doing bad, you need to do better. there's a whole continuum in between those two. But something that I'm trying to push them to do that's also kind of more objective and trackable for improvement is obtaining a certification or taking extra CEUs outside of what they get with their 4J kind of physical medicine journeyman education in the Air Force. So sure, they're going to get that. They're going to come out of tech school, be 3 level, get 5 level, 7 level. But something that I'll ask my techs about are, hey, are you pursuing like PTA or physical therapist assistant licensure?
Yeah.
That's a good state license, and that's like cool. You could go practice on the outside, and that's like kind of tip of the spear tech kind of stuff. To my knowledge, there's only like 10% of our 4Js have that.
Oh, wow.
Stuff like a personal training certification, a strength and conditioning certification, tactical strength and conditioning certifications, or even just the process of like, hey, I'm reading a new book about strength training, or I'm listening to some podcasts and kind of putting that in their feedback of like, hey, they're actively taking steps to learn more outside of just what the norm is.
Yeah.
So that's kind of how I measure performance. I don't get too caught up in digging through charts and measuring patient outcome kind of things. And that's kind of like on the other kind of swing. I feel like that'd be subjective or like micromanaging of me to do that and be like, oh, you're only 70% of your patients are getting better. That might not be because of the tech or provider, but if we saw like a bunch of ICE comments coming in and a staff member's getting less than desirable customer service reports from patients, that could be something where we're like, ooh, that says something about your performance from not necessarily our end of provider staff, but the patients are now noticing this, and they're our customer. They're the ones that we want to be taken care of.
Right.
That's kind of an ongoing, can be positive or constructive in nature. And we will encourage it at some of that stuff too. Like if I hear stories from patients of like, even if it's one of my texts, like, hey, put in ICE comments in because then we can talk about it.
Yeah.
And we can address it and make the team better based off of what you're experiencing in our clinic.
What methods have you found effective in motivating and developing your people, your staff?
One specific technique that I like to do, I don't think the video can, well, actually, the video captures this. We're in a very small space.
Yeah.
I tend not to practice with my door shut and just live in my office all day.
Yeah.
And then my techs that are out in the gym treating patients don't see what I'm doing or how I interact with patients. And I've gotten good feedback on them from it where they're like, hey, totally forgot about doing that technique for somebody's hip, for this, for that, or it was cool hearing how you described this to a patient or that feedback that the patient gave you. I kind of like that dynamic working environment where everybody can like kind of see each other. It just makes it a little bit more fun and learn too of like, I'll do that with therapists, like be like, oh shoot, I totally forgot about that test, or tell me more about that treatment that I might not know about.
Right.
Kind of a thing. And I've gotten good feedback from my techs here that kind of intrinsically motivates them to be like, oh wow, like Andrew is doing a lot of the treatment out in the gym where we can see him and he's doing this stuff that is new or we don't know about. And then they'll start asking good questions or start doing some research on their own. So I try not to kind of silo or isolate myself in my office as best as possible.
Okay. Can you share an example of how you provided constructive feedback to a team member to help them grow professionally?
Got a few. Let's see. One of them will stick out to me. Constructive feedback to a team member to help them grow professionally. I'll use an example from, say, I have 2 technicians that come to mind recently that were new accessions to the Air Force as A1Cs that had bachelor's degrees in exercise science kinesiology from really good schools. Mm-hmm. So the first one was one of my techs at Langley, and she had really good patient rapport. People really liked working with her. And we kind of identified that. We were like, wow, like Airman so-and-so is really good. We need to get them out doing more outreach kind of stuff. So instead of just me going out to all of these units doing some embedded care, we gave her the feedback of like, hey, what are you engaged with outside of the clinic? She was like, honestly, probably not much. And I was like, you have a very outgoing type personality type. I think something that could be helpful for you is kind of leveraging the friends you have in other units to use your physical medicine and exercise science expertise to help their unit and make them better. And she was like, oh yeah, that totally makes sense because she would be hanging out with those people anyways. So she started leveraging her own networking there, and then she saw that between me and one of our other providers, we were constantly going out to other units like the engineers, EOD, cops, and we would ask her, hey, do you want to tag along? We're going to do some outreach to kind of push her and kind of grow her outgoing personality in a professional sense. And then one of our techs here, just from, again, I'm new 6 months here, as I'm getting to know people, I was like, identified, holy smokes, you have a degree from one of the best exercise science programs in the country from App State. I was like, what are you interested in? Like, how did you wind up in the Air Force doing physical medicine kind of stuff? And the feedback I gave him was like, I was like, dude, you need to share that with people and let them know, like, hey, I have a lot of experience in exercise science. Maybe I'm not sure what I want to do yet, but letting people know that so that we can leverage his strengths and figure out kind of where we can help him kind of funnel or guide his Air Force journey as somebody that's brand new but has a really top-notch exercise science education that will spill over and be applicable in the Air Force.
For sure. That's awesome. Kind of a shift here onto budgeting priorities. How do you prioritize budget allocations within the department and ensure like optimal patient care while still managing cost? And I know from like your aspect, you may not have a whole lot of hands in that, but you might have a say in some things that you want to get and make better for the clinic. So.
For sure. And I'll preface kind of that question by saying usually running a military PT clinic usually is pretty low cost because from a day-to-day supply aspect, like we'll have some TheraBands, some tape, some trigger point needles, but there's not a whole bunch of stock like dental composite materials and like bone graft and
our
these things that
$60,000 budget a month.
Yes, that are really expensive. Last year, I think our budget that we were allocated at Incirlik was like $4,000 a month. And I was like, I found that out like 3/4 of the way in when I started asking for different things, but I was like, oh, I didn't know that. That would have been a helpful question for me to ask. And I was like, I got here and I was like, hey, what's our budget? Cool, $10,000 a month. We can make that work. Knowing that we don't have as much equipment and supply to keep up with, that kind of lets us be judicious with what kind of new things that we get that's more on the fringe of like, hey, college sports teams, pro sports teams have these pieces of equipment that aren't like essential per se, but with the caliber of provider and tech that we get, they're used to using them. So it's like, hey, we're treating tactical athletes. We should have these things. Like last year, we got a $60,000 fancy heat cold compress machine when we just had a little freezer that somebody threw out anyways. So we had no ice, no heat, no modalities. But advocating for that to the hospital leadership, they realized they were like, okay, shoot, if all of these other units and sports teams have it, we should probably have it too. And knowing when to ask for things and when to not. And I think even bigger than finance is more budgeting and allocating our time well, and not necessarily spreading ourselves too thin and being really, really busy, or not making ourselves not busy enough where then it's like, well, if you match up how much you're billing for and how much your staff is getting paid, those should at least match up. Like that's something that I'll look for in my OPR every year is like, okay, I make this much. How much care did I produce this year? If I'm not productive enough, I had a squadron commander tell me, they were like, that's one of the first things that we'll look for is, are you at least being productive enough and meeting the standard? So that kind of shifts how I budget my time. And that'll be different person to person, but I try to have people at least be able to be a little bit flexible in budgeting their time to kind of make the patient care match how they perform the best. Time is money.
Yeah.
So that's where I'll kind of use both of those and not just get caught up too much in the money. Because somebody could argue like the time aspect of rehab is worth more than the potentially small budget that we get on a monthly or annual basis.
Okay. How do you contribute to establishing and maintaining a positive image for the physical therapy department?
I get out of my office.
You bring Cooper.
I bring my therapy dog. I stay out of my office. I think a lot of the
Had to make sure he gets in there.
As long as, again, like back to the first question, as long as patients are happy with the care that they get, they're happy with the clinic, they're happy with their provider, and good things will kind of spread by word of mouth. And I try to do what I tell other people to do and kind of play how I practice in terms of like PT medicine kind of stuff, and kind of champion my own fitness well. Try to be seen like working out in the clinic sometimes, or kind of asking other technicians if they want to come work out at one of the gyms on base so they can train with me and some of the other folks that I'll train with from operational units. I think a positive brand image for the clinic will kind of come naturally if you kind of check some of those lower hanging fruits, and it's like, cool, the clinic, people are getting taken care of, the staff's getting along, patients are getting better, they're talking about it, and then people just will generally have good things to say and have good interactions with most of the staff.
Is there anything specific that you did, like to implement a strategy to enhance the reputation or gain visibility? I know you guys do go out to units and stuff sometimes. Is that kind of your way of getting that visibility out there and educating other units and stuff?
Yeah, that's been a big thing of mine since I started doing this in the Air Force 4 or 5 years ago, was identifying kind of with who was already coming in the clinic, what units needed more help, or who had barriers to accessing the hospital. Because let's say, for example, on this base, we are 30 minutes away from the Air Support Operations Squadron where the TACP guys work. So they're like, well, shoot, if I want to get one of my aches or pains or something looked at, I need to drive a half an hour one way, go to a 45-minute appointment, drive 30 minutes all the way back the other way, and then miss a third of my workday, kind of thing. So kind of identifying some of those barriers, doing good care in here, so that if I say, hey, like, is there any, like, if you know anybody else that needs help, my schedule's pretty flexible, happy to help where I can, or hey, do you mind if we work out together, or if I come by and just see where you guys work, and be willing to learn from their operational expertise, because they're the expert in directing aircraft, flying the aircraft, putting the aircraft back together, managing the logistics of the plane. And that's where I'll kind of justify my outreach too, of like, hey, the commander's prerogative is to optimize joint medical readiness to project air power.
Yeah.
I can kind of facilitate projecting air power from my office, but the more people that I capture that are not being seen for these things, will help them do their job better if they know us, they trust us, we're out in their space, even if it's just interacting, chit-chatting with them. I don't need to go do PT out there, but if they're like, oh, hey, they're willing to learn about our job, that's really cool. And then they'll be more open to kind of disclose some of those issues with us and kind of help fine-tune their programming and go from there.
And this is another one that I'm not 100% sure that you have a whole lot of ties for. But what strategies do you employ to ensure smooth operations and maintenance of the facilities?
I feel like that's a first thing that pops in my head, is just being a good steward of your space.
Yeah.
And like knowing, like most of us know how a PT clinic runs, or if we get a new tech that doesn't, like, hey, here's what we do. Like, here's the equipment that needs kept up on at this interval. Make sure it's clean. If it's not clean, people are like, what the heck kind of space is this? Be clean. We work here, so treat it like it's your own. Treat the clinic like it is your own kind of work center. And the facilities are usually pretty easy to maintain in the hospital. When we start talking about like embedded clinics, like at fighter squadrons, at special operations facilities, where it's like, hey, we'll give you this closet, can you make a little PT room for us? And it's like, yes, but it takes a lot of work to get those like Joint Commission inspectable kind of things, or even just something as simple as like building somebody their own small facility that they can use, not necessarily for like provision of care, but like at Fort Bragg, we built them a little annex of our facility, because they had some extra money. So we're like, we can build you a little recovery nook that you can just come and do some recovery stuff with some of the Normatec boots, the game ready stuff, some ice, modalities, Theraguns, and just, it's not necessarily PT, but they respected our space enough that then when that extra money came out, we were able to say, hey, you guys are actually really good. This will benefit you. Here's a little, you can take ownership or a little chunk of our facility and kind of make it yours as a little spin-off. But, and then the second part of that question, facility related challenges can be easy and or difficult to manage depending on like if it's like the building is falling apart or it's like structural and then we need to reach out to like somebody outside the hospital to get it fixed.
When we were in Turkey, the flooring, how was that to overcome? Like, because I know that they had said like it was disgusting and it wasn't what you wanted, and then it is definitely a huge difference in here.
Mm-hmm.
Did they ever get the funding to be able to replace that, or how did that ever work?
I don't know. But it got to the point where they, at least the leadership on the base was like, yes, you should have better flooring so that there's not like a good quarter-inch of dust on there after a week or two. But it's hard with, there's medical money and then line money, so it's like, who's going to pay for it? But usually from a healthcare facility perspective, they want the facility to provide the best patient care and be safe for just the best, cleanest patient experience. So as long as you frame it like that of like, hey, we just like, we should be able to provide the best medicine and have it be the safest facility for our patients. This facility barrier gets in the way. Can you help us tackle this objective? Usually they'll say yes, versus asking for like, well, I have an elliptical, but I really want a fancy one, and not really tie it to like a safety or facility kind of management issue. More that nicety versus like, hey, there's a deficit in our facility. Help us fix it.
Yeah. How do you prioritize and enforce safety protocols within your department and ensure the well-being of both the patients and the staff?
I mean, safety, safety for the patient is always has to be the top priority.
Mm-hmm.
And again, like, as long as that should be first and foremost for, hey, are we taking care of our patients? Well, if we're not practicing safe, the answer is automatically going to be no, even if they think they're getting like the best treatment ever.
Right.
If we're doing some like really cavalier stuff, or like, let's say I have a tech like trigger point needling somebody and they're not qualified to be able to do that because none of them are. It's like, hey, that's not safe. How did that behavior get enabled? Kind of a thing. I feel like that's we rarely have to address that because it's already built into the character property of the staff member to like understand that, yep, safety's number one.
Yeah.
We're taking care of our folks and they feel like this is a safe place to come to get care. Cool. Everything else falls in line after that. So I don't have any specific examples for having to have dealt with that from like, I haven't observed anybody doing anything like grossly unsafe where I was like, oh my gosh, stop.
That's good.
Yeah.
And then how do you ensure that ethical standards are upheld within the department, particularly sensitive situations such as patient confidentiality, especially with like such an open platform, multiple patients at a time, that type of thing?
Usually from the more sensitive things will come out in conversations, usually with the provider, either the first visit or like a follow-up visit where we'll be potentially behind a closed door anyways, or somewhere where I could just kind of reach and go, I know where this is going, let me shut my door so that not everybody else hears it.
Yeah.
Or actually, I did have an instance this morning somewhere else where I was kind of putting on that listening hat and just listening to where this patient was kind of going with this introspection and some cognitive behavioral stuff that they've been working on from like a holistic spiritual kind of aspect. And there were like 4 or 5 other people in this really small space. And we both kind of knew, like, he self-identified where the conversation was going, and he asked, hey, like, do you mind if we talk in one of the other offices? And I think he was able to do that because we had already had really good rapport from me working with this individual for probably like 4 or 5 months. We're on the ethics question, right?
Yes.
Yes. But I feel like that building good rapport kind of makes the ethics stuff easier. And I don't know, I feel like PTs don't really get themselves in questionable ethical scenarios all that frequently because we just want to help people, and none of our treatments are really too cavalier unless I was like dry needling people like all over the place, like out in the parking lot kind of thing. Like, okay, ethically that's not right because I'm operating outside of a healthcare facility. But in terms of managing that patient confidentiality, in open spaces, as long as we're aware of it, and usually like the techs will know like when we're kind of playing that less physical therapist role and more kind of well-being listening therapist role, and we can kind of redirect to a different spot in the room or kind of redirect to an office and just listen to what that person has to say.
Now, I don't know if it's different for your career field, but have you ever been at a base where you guys have had so much patient overload that you've had to refer them off base for care as well? And then did you ever notice or talk to the patient, or did it ever seem like those off-base providers would try to overcharge or over diagnose something that maybe the patient didn't need or anything like that? That could potentially be an ethical issue.
Not really. And I think it's less of some things, or a few examples of what I've heard people say from care that they've gotten off base is more that like sometimes it's hard for a non-active duty provider or PT to understand what they do for work. So I've had a few fighter pilots that they're like, yeah, that the person off base just, they don't really do sports. They just do kind of general outpatient PT. They don't understand the demands of pulling G's in a fighter aircraft where like they're like, we know you guys at least, even if I don't, they might perceive that I do. And then I can cut, that's kind of gives me a one up. Or it'll become a situation of like, does everybody really need to be seen 2 or 3 times a week for a month for whatever their issue is?
Right.
Usually not. So if we're really practicing the best evidence-based medicine, I can say, hey, like, you're functioning really well. Here's what I want you to work on, and kind of champion the patient to be a good self-manager of their ache or pain or condition, instead of charging for them to sit on like a hot pack or a stem or adjust their back twice a week for 4 weeks and think that's going to get better. I think we can be more, or in the military, we're more intentional on giving the skilled intervention to people that need it because we have no financial gain from how much or how little we treat somebody, versus if somebody goes off base, like that clinic, back to the facilities and budgeting kind of question, like they have ends to meet for paying their staff, keeping the lights on and stuff like that, where they can say, okay, yeah, it's not unethical to see somebody twice a week for 4 weeks, but do you really need it?
Right.
Or could we see you once a week or once every other week? And I can be more judicious and kind of budget my time and then be a better steward of the person's time.
Right.
And that kind of falls into like the evidence-based triangle of like, we know what's best per the research, the clinician has their own expertise, and then the patient experience is part of that evidence-based and ethics kind of thing. Like, straight up ask somebody, do you want to be seen off base?
Right.
And if they say yes and they have good rapport with the therapist off base, usually our referrals are pretty backed up anyways. We can say, hey, okay, I want you to continue with that therapist that you've had success with.
Right.
Or if they insist like, nope, I want to be seen on base because you know what happens to my neck in fighter aircraft, we can be flexible and make that work and kind of put those 3 things, research, our expertise, and the patient's experience together, to meet the ethics and good outcomes of our practice.
All right. And then the next 2 questions, honestly, they're on patient or professional development and patient-centered care. And I feel like we really hit heavy on those already, especially because you said, as long as you're taking care of the patient, everything else falls in line. And then you talked about all the different professional development opportunities for your team and things of that nature. As far as for you, what does professional development look like for you outside of here?
Outside of like PT, outside of the military? Outside
the military. Like, what is your end goal one day? And like, how are you going to get there professionally?
end goal. Do I want to practice PT for forever? Maybe. I don't think. I think I chose physical therapy as a profession because it was something that I saw intrinsic value in
hmm
from a kind of medicine subspecialty instead of going to like chiropractic school or medical school or occupational therapy school or something like that. Um, Ultimately, my end goal is like as long as I can provide for my family and do the cool family things that we need to be able to do, um, that's priority number one. I also want to have good job satisfaction
Yeah.
and not have that affect my family or personal life. So if it ever got to the point where like this was messing with this, I would still choose what's best for me or for my own health, well-being, and my family,
Right.
and then feel good about whatever number of years of service I gave to the Air Force. Um, but as long as I don't know, I feel like I see myself going more into like kind of niche sports operational type PT fields. I don't like being bound by my walls in here. Or I don't like being, let's say, like reactive in nature
Yeah.
to medicine. I like being more proactive and building relationships with people and being able to help them maybe even before they know they need it. And they're
hmm
like, hey, I know this guy's a sport ortho kind of PT expert type person. He might be able to help me out before I get hurt or something
Right.
like that. So that's kind of where I'm seeking out other military trainings to understand what our operators and pilots and soldiers do so that I can kind of blend my PT knowledge with some of those things to provide a more just a better experience for like sports medicine kind of stuff.
Do you have a favorite sport?
I was a tennis player in college.
Do you
I
ever
haven't
see
played
yourself being like embedded into a tennis team and being like
because that's too much of a one-on-one. Or like I played, if you play doubles, cool, it's a two-person sport. Or
Yeah.
singles, like for some of the pros, they will have their own physio, so it's
Right.
like cool. I have one patient.
Not
I don't know. It might
exciting enough for you?
sound fun, but I would like to. I don't know. I don't know if I could do it.
Yeah.
Maybe. But again, like if something like that worked best for my family, and they're like, "We'll pay you X amount to just work with me and go to my tournaments." Yeah, sure, because I have that experience.
Yeah.
But I like the flexibility that my job kind of has now to do what I like, meet the mission of the unit to um, operationalize the product of what PT does for these people so that the base can project the air power that they need um, and then get out and about more and understand more of what the guys and gals do on the space and who needs our help the most.
Well, thank you for your time.
Sure thing. Yeah, that was fun.